Now, most people don't realize this, but in Asian rhinoplasty, you're not trying to make the nose smaller, we're actually trying to make it bigger. That surprises a lot of patients when they first hear it. Hi, I'm Dr. Shim Ching, board certified plastic surgeon here in Honolulu, Hawaii. Today, I want to talk to you about something that's fundamental to Asian rhinoplasty, and that's cartilage. Why we need it, where we get it, and when we might use something else instead, like a silicone implant. This is one of the most common questions I get from patients who are considering rhinoplasty, especially those of Asian descent. Now, they'll ask, do I really need cartilage for my nose surgery? Can you just lift the bridge with an implant? And the answer depends on the anatomy of the nose and the goals of the patient. In general, the biggest difference between Asian and Caucasian rhinoplasty is that in Caucasian rhinoplasty, we're actually reducing the size of the nose, lowering a high bridge, refining the tip, narrowing the width. In Asian rhinoplasty, we're almost doing the exact opposite. We're building up the nose, giving it more structure and increasing definition. Usually the areas that need augmentation are the bridge and the tip of the nose. Sometimes we narrow the base of the nose, what we call the alar base, to reduce flare, but in most other areas, we're actually adding height and projection, not taking it away. Let's start with the bridge, because that's the most common area that patients want improved. In many Asian patients, the bridge of the nose, which runs between the eyes down to the mid-nose, tends to be lower and less projected. This can make glasses sit awkwardly or slide down easily. It can also make the profile appear flatter and less defined. A higher, stronger bridge adds definition to the entire face. It helps balance the features, give a more refined and structured appearance, especially in your profile. The upper third or half of the bridge is bone, while the lower portion is cartilage. Both areas can be augmented to create a higher and smoother contour. So when we build up the bridge, we're essentially reconstructing the internal framework of the nose. And once the bridge is raised, the tip of the nose must follow. Otherwise, the nose can look out of balance. It's very rare that we can just raise the bridge without adjusting the tip. The two need to harmonize with each other to create a natural result. And there are a few ways to build up the bridge. The most straightforward way and a time-tested method is using a silicone implant. Silicone has been used in rhinoplasty for decades, particularly in Asia. It's one of the most reliable and predictable materials for creating height and definition of the bridge. In the United States, though, silicone implants have fallen out of favor. A lot of surgeons here prefer to use cartilage either from the nose, the ear, or even the rib, but in Asia, where millions of rhinoplasties are performed every year, silicone remains the most common material used, and for good reason. Silicone implants are simple, consistent, and very safe when they're placed correctly. They've been used in the body for over 50 years in breast implants, chin implants, even facial implants, and the material itself is very stable. Biggest advantage is that silicone doesn't require harvesting tissue from another part of your body. When we use cartilage instead, we have to take it from somewhere. Main sources are the septum, and that's the inside of the nose, the ear, or the rib. Septal cartilage is ideal when it's available, but in many Asian patients, the septum is much smaller and provides only limited material. That cartilage is often just enough for the tip of the nose, but not to build up the entire bridge. Ear cartilage is another option. It's soft, it's curved, great for small grafts, but again, it's limited in size, not strong enough for major structural support. That leaves rib cartilage, which is the most commonly used option for building up the bridge in Asian rhinoplasty when we're not using a silicone implant. Rib cartilage gives us a large amount of material, allows us to carve it into the desired shape, long, smooth, and strong, but harvesting rib cartilage does add complexity to the surgery. It requires a separate incision on the chest, it can be painful afterwards, almost like a small rib fracture. That's one of the main downsides. Patients may feel soreness for several weeks in that area, and it does increase your overall recovery time. Also adds operating time and costs. So while it's a very effective option, it's not a small decision to make. And that's why many surgeons in Asia continue to use silicone implants. They can be precisely shaped, inserted through a small incision, positioned perfectly along the bridge. They've been proven to be stable, long-lasting, in many cases, easier to revise if needed later on. I still use silicone implants in my practice for the right patients. When done properly, they're safe, reliable, and produce beautiful results. The key is technique, knowing how to choose the right implant size, shape, and placement. Now, it's true that years ago, there were complications related to silicone implants, especially the L-shaped ones. These older designs extended down into the tip of the nose, placed a lot of pressure on the nasal skin. That tension could cause thinning or extrusion over time, meaning the implant could push out through the skin. So we don't use that approach anymore. Today, we use what's called a dorsal implant. It sits only on the bridge and not on the tip. Is shaped and projected with cartilage instead. And by separating the two, silicone for the bridge, cartilage for the tip, we remove that tension and make the procedure much safer. This hybrid approach combines the best of both worlds, the precision and longevity of silicone for the bridge, natural flexible feel cartilage for the tip. When it's done correctly, the results are natural, smooth, and balanced. Cartilage, on the other hand, does have some limitations. Even though it's your own tissue, it can change shape over time. It can warp, meaning it bends or twists after it's placed, or it can resorb, which means it gradually shrinks. That can make the bridge lose some of its height or become uneven years later. Silicone doesn't change shape. It looks the same 10 years later as it did on the day of surgery. That's one reason why for many patients it's still an excellent choice. Every approach has its pros and cons. It's really about what's right for each individual. For somebody who prefers an all-natural approach, cartilage is great, as long as they understand the trade-offs. For somebody who wants a more predictable, durable result with less additional surgery, silicone may make sense. The most important thing is how it's done. The skill of the surgeon, design of the implant, attention to balance between the bridge and the tip. We build up the bridge. We always make sure that the tip is proportionate. Bridge is too high, tip too low, result looks artificial. Both are aligned properly, the profile looks elegant and natural. In the end, my goal is always harmony, creating a nose that fits your face, your ethnicity, and your features. For Asian rhinoplasty, that often means a little more projection, a little more height, but still keeping it soft and refined. So to summarize, in Asian rhinoplasty, we're often augmenting the bridge and tip rather than reducing them. Cartilage is incredibly useful for shaping and supporting the tip of the nose, while silicone implants can be a safe and effective way to raise the bridge. Both can be combined to achieve a balanced and natural result. In my next video, we'll go deeper into the tip of the nose, how cartilage is used to build it up, refine shape, and create definition that looks natural from every angle. I'm Dr. Shim Ching, board-certified plastic surgeon, Honolulu, Hawaii. Thank you so much for watching, and I will see you in the next video.